It took hundreds of thousands of years for the world population to grow to 1 billion. And in just another 200 years or so, it grew sevenfold. In 2011, the global population reached the 7 billion mark, and it is projected to climb to over 9 billion by 2050. This dramatic growth has been driven largely by increasing numbers of people surviving to reproductive age, and has been accompanied by major changes in fertility rates, increasing urbanization, and accelerated migration. Now, these trends will have far-reaching implications for generations to come. The one important issue associated with these population trends is, of course, our health. So today we reflect on world population and health. We have a panel of experts from the UNFPA, AMREF HEALTH Africa, Pretoria and Wits Universities, who will help us understand a little more about world population and associated health issues you and I need to know about. So sit back, relax, and learn from the exciting show ahead. Be part of this show by calling us with your questions or views on Johannesburg 714-6843, 6847, or 6857, or interact with us on our Facebook page, SABC Health Talk, and on Twitter at SABC Health Talk, including our email address, healthtalk@sabc.co.za. I'm Dr. Sililo Mutaung, and this is Health Talk.
As the world population grows and the proportion of elderly people increases, the number of people living in the suboptimum health is set to rise rapidly over coming decades. In the past 23 years, the leading causes of health loss have hardly changed. Low back pain, depression, iron deficiency, neck pain, and age-related hearing loss, resulting in the largest overall health loss worldwide. A new global tally of health finds that only about 4% of people worldwide had no health problems in 2013, while a third, about 2.3 billion people, had more than 5 health problems, and the situation is getting worse, not better. The proportion of years of healthy life people lost because of illness, rather than simply dying earlier, rose from 21% in 1990 to 31% in 2013, according to the Global Burden of Disease study. In 2014, more than 1.9 billion adults 18 years and older were overweight. Of these, over 600 million were obese. 39% of adults aged between 18 and over were overweight in 2014, and 13% were obese. Most of the world's population lives in the countries where overweight and obesity kills more people than underweight. 42 million children under the age of 5 were overweight and obese in 2013. Despite big improvement, inequalities between and within countries and regions persist. In Southern Asia, about 47% of the population is using improved sanitation facilities in 2015, compared to Sub-Saharan Africa, who made slower progress.
Okay, now, World Population Day is an annual event observed on July the 11th every year and seeks to raise awareness on, global population issues. Now, let's understand a little more about this World Population Day from our guests. We have, first up, Dr. Esther Moya from the United Nations Population Fund, and she's the South African Country Office Director. And, of course, next to her we have Dr. Flavia Senkobuge, who's a public health specialist from the University of Pretoria. Ladies, welcome to Health Talk.
Morning, thank you.
Let's start with you, Dr. Moya. Now, World Population Day. What is the significance of World Population Day?
Good morning again. World Population Day is a day that has been set aside to really examine global issues around population. And the idea is to look at what's happening with the numbers of people out there. Is there anything special that the world needs to focus on at any particular time to really give it some flavor about population? And today, being July 11th, we are actually celebrating the 26th birthday of World Population Day, which was first celebrated in 1989 when it was recognized that we need to focus on issues globally around population.
Is this something that is driven by the United Nations? And in fact, I see that, I mean, your organization, UNFPA, is the one that appears to be behind this. Perhaps just for a start, tell us about your organization, UNFPA, and how it's structured. I see you have you're the South African country director for the program. Tell us a bit about your organization.
Okay. United Nations Population Fund is a fund, as it says, one of the agencies within the United Nations, which focuses on issues around population and development. Being a development agency per se, we look at how does population influence development and what interventions need to be put in place to help move development within the country. The United Nations Population Fund is global. We operate in over 150 countries. And this means we have a headquarters. We're headquartered in New York with an executive director, and we have an executive committee with a senior management team in place. Right. But we work out in countries, and our main focus is really around the well-being of women and children, and directly and indirectly families. But more so, we are focusing now more and more on young people, because we realize the importance of the bulge of young people within populations and how they impact on population and development agendas around, which centers around the Millennium Development Goals that are just coming to a close and moving into the social development goals, which we shall focus on beyond 2015. And therefore, UNFPA's mandate is really looking at how can the world influence the well-being of women and young people, and especially the girl child, to ensure that countries achieve their development goals. So ours is really to support countries to achieve their development goals, focusing on that.
Okay. Dr. Sinkubuge, I mean, in my introduction, I mentioned, the issue around the world population being growing and so on. And there's clearly over the years been some trends that have been, seen. But just insofar as these relate to health, can you perhaps just take us through, the health issues associated with population trends in general?
Thank you very much, Dr. Mtaung. I think the one thing that, and I think my colleague has just alluded to it, in terms of having a global discourse together about populations and what's happening to populations, means that we pull together resources and find solutions. So what's happening now is that in the health context, we're having complex health issues. And previously, we really, especially in the developing countries, we used to talk about communicable diseases, HIV and AIDS, TB, malaria mostly. But now in the world population, because we have a ballooning of world population, we're now having newer, or we would say maybe, some people would say they may not be that newer, but now we are examining and seeing these conditions. So mostly in most countries globally, we're having communicable diseases and non-communicable diseases. And these would be your hypertensive, diabetes, mental health issues, which are quite far-reaching. We also now, in some countries, have got an added triple burden of disease, which would then include violence and injury. And I think it's quite pertinent, especially for this World Population Day, to have a conversation about that. And so that's what's happening to the world population at the moment in terms of health-wise. The triple burden of disease, communicable diseases, non-communicable, and violence and injury.
Yeah. Dr. Moyo, I mean, is there, we obviously are in Southern Africa now. We obviously are having a global view on this. But is this region that we're in any different from the rest of the world?
The region we are in does have its special concerns. One of the things which we also look at as UNFPA is sexual and reproductive health and rights. And it is this that leads to the reproductiveness or the reproduction within the population. But there are factors that come in that can impact on the sexual and reproductive health of people. One of them, as Dr. Flavian has just mentioned, is around conflict and displacement of persons. When people are displaced, it doesn't mean they stop having sex. When people are displaced, it doesn't mean their rights are put aside. They're disrupted, but their rights still have to be observed. One other aspect around the disease scenario is the issue of HIV and AIDS. We know the Southern African region arrived late on the map for the epidemic of HIV and AIDS. But really what HIV and AIDS has done in this region, and specifically this sub-region, is to undo the gains that had been made. However, because of data that has been availed to governments and policymakers, and evidence that has been generated around it, governments have been able to respond. Take, for example, within Southern Africa, the treatment program has really picked up, and therefore reducing some of the burden on the social sectors that had been seen earlier in other countries. And therefore, really just looking at what's going on in the sub-region, the disease patterns are different. When it comes to conflicts and emergencies, people move from their normal areas. And who is most affected? These are the people who the governments and our policymakers need to focus on to ensure that they provide for them to continue observing their rights.
Okay. Just on that, I mean, we hear that this year's World Population Day has a theme, which is slightly different from last year. Apparently last year the theme was the fact that, you know, we have more youth, which probably has relevance also to the HIV and AIDS problem that you faced. Tell us more about the theme for this year.
Okay, the theme for this year is vulnerable populations in emergencies.
Right.
And emergencies can be natural or they can be man-made. And they are emergencies because they are unforeseen. And just as I was alluding earlier, there are certain groups of people, and that's why when you look at population trends, you look at who is most affected in emergencies.
Yeah.
Often it turns out that during emergencies, people have to move from their normal environment.
Yeah.
And who is most displaced? Usually you find it's women and children who tend to be displaced during emergencies.
All right, so these are the vulnerable populations we're going to be talking about now, children and women. All right, let's just leave it there because we need to go for a quick commercial break and ask the question, what is stunting in children and how can it be managed? We'll find out after the break. Please stay with us.
From humble beginnings, this selfless icon altered the history of the world, freed a country, and united a nation. He taught us humility and forgiveness. To the world, he is Nelson Rolihlahla Mandela. But to us, he is simply Tata Madiba.
Welcome back. Now, nearly half of all deaths in children under 5 are attributable to undernutrition. Undernutrition puts children at greater risk of dying from common infections, increases the frequency and severity of such infections, and contributes to delayed recovery. Now, poor nutrition in the first 1,000 days of a child's life can lead to stunted growth. Now, stunting has been described as being stubbornly persistent in South Africa and remains a huge challenge. Let's understand more from our guests. We still have Dr. Flavia Senkubuge, public health specialist from University of Pretoria. We're now joined by Dr. Rilad Said Mohammed, Dr. Rilad Said Mohammed is a postdoctoral research fellow based in the Department of Pediatrics and Child Health at the University of Witwatersrand, or Wits University as we know it. Welcome to Health Talk.
Thank you.
Now, this is an interesting one. You know, we've been looking at the nutrition-related problems in South Africa, or worldwide for that matter, and obesity in children has been a huge problem. Now, what you're telling us is that, in fact, hey, we need to look the other way. Stunting is becoming a problem in South Africa. Tell us about it. Just, by the way, let's just define what is this stunting. You know, when you talk stunts, people think movies and, you know, stunts. What is stunting?
So, in a simple word, stunting means when a child is short for his age.
Right.
So we compare the height for age of that child with international standard.
Yeah.
So we compare that child with another child living in a better environment, with an optimal environment.
Yeah.
And we compare their height for the same age.
Right.
So you're stunted if you're shorter for your age,
Okay.
in essence.
So you might not necessarily look malnourished.
No.
But you're just shorter for...
Exactly.
Okay. Now, why does that happen? What causes stunting?
So stunting is quite complex as all malnutrition, including overweight and obesity. So it has multiple causes.
Now, hang on. So you're saying you can still be obese and stunted?
Absolutely.
Interesting.
Yeah. So this is what we call the double burden of malnutrition, actually.
Right.
So you have causes that are really proximate. So in the household, if there is no access to good quality food for the child, I mean healthy food, and also if the child is confronted with a lot of chronic infectious disease, that can affect his growth directly. Then you have less proximate, I'd say, causes which are more related to the policies and whether people have access to healthcare, whether people have access to education, what is the situation of the country in terms of food security, and all the policies that are put in place to allow people to have access to food, care, health, and so on.
But interesting. How widespread is this problem in South Africa? I mean, people don't know about this stunting being a problem. Everybody thinks it's the other end of the scale.
So in our study, we looked at the evolution of stunting since 1970 in South Africa. 1970? Yeah, till now. Right. So what we've seen is, the recent South African National Survey, nutritional survey, showed that there is a decrease in stunting if you look at the age range between 0 to 14 years old. So the percentage is 15%. But you need to go into this number to understand that, in fact, if you look at the children between 0 and 3 years old, 1/4 of them are stunted, which is a high, for WHO is considered as a medium prevalence. So it's quite high for South Africa.
So 1 out of every 4 such children.
Yeah.
This is concerning. Now, just lastly, before I get to Dr. Senkubuge, what are the long-term effects of stunting?
I think one important thing is to see that stunting will have an effect all the way through the life course. So from your childhood to your adulthood. So in the childhood period, the most important effect that we see is first your physical growth is delayed, but also there is impact on cognitive development, meaning that the kids will not be able to be successful at school. In the long run, what we see in our studies is that there is an association between stunting and the risk of being obese during adulthood, of having cardiovascular disease such as hypertension, stroke, and also type 2 diabetes. So it has short-term and long-term effects that need to be taken into account. And now I'm going to say that actually being undernourished, stunted, is linked to obesity. So they are not in the extreme spectrum of malnutrition, but they are actually associated and related.
Yeah. I mean, the one, obesity, for instance, may be short-term. What about stunting? I mean, is it something that develops over a period of time?
So stunting is markedly and affects an individual during the first 2 years of life. This is where we can intervene and affect and change the growth of the children. Past that time, we know that it's difficult to reverse and have a proper growth of the children. So that's why we insist now in the first 1,000 days, including maternal health during her pregnancy, because it starts there. So the fetal growth is also important, and it's going to determine how the infant is going to grow.
Dr. Senkubega, I mean, clearly this has major public health and economic implications. Take us through that.
Absolutely, Dr. Mdaung, and I think Dr. Said Mohammed said it perfectly. In public health, we're very obsessed with numbers. So one of the key numbers that we look at is how well children are doing. Right. How well children are doing is a proxy of how our health system is doing. Right. And so if we've got 1/4 of children still stunted in this country, it means that we're doing something wrong in our health system. It means then we don't, many things, maybe there's no access, maybe, because remember that a child has got two partners. It's the child themselves, the mother themselves, and then also you could maybe add a third element, the health system itself. And so the long-term public health implications is what she's saying. The first one is that if you look at the distal end of it, if we have more obese children, more obese adults and that with cardiovascular risks, strokes and the likes, you then have a huge disease burden that's impacted on it, and that increases the number of non-communicable diseases. On the other hand, one of the things that is quite key also to stunted children is their development and how well they are doing in society. And so if a child is not doing well in society, they will have low levels of education, and therefore they're not going to be an economically viable adult. And this affects, we like the numbers of GDPs and all the different numbers that determine how well we are doing as countries. Right. And so if we are not having economically, adults who are doing and contributing to the economy, it will definitely affect the economy broadly. So the two public health implications, the one is about the health burden and also the burden to the child themselves, and also I think the broader socio-economic burden.
Right. Dr. Said Mohammed, now having looked at the risk factors and the causes, how do you think or what should be done to try and minimize, this problem, or prevent it in the first place?
So I think South Africa is in the good track with the new roadmap to nutrition that was launched by the Directorate of Nutrition. So that roadmap is aiming at, have an impact on stunting and all the form of malnutrition using a multi-sectoral approach. As I was saying, there is what is more proximate, the household, but there is more policy that need to be involved, and also more commitment from the government, which implies not only the Department of Health, but that maybe education, industry, agriculture, all these policies need also to have some policies that are more nutritional driven and equity driven, because poverty and inequalities are also huge causes of malnutrition. So that's one aspect. In terms of targeting people, I think pregnant women, actually women health and child and infant health during the first 1,000 days are very critical to attend to. Things like
breastfeeding, for instance.
Breastfeeding is very important.
Okay. Well, this is very interesting, and I'm sure we'll, when we have more time next time, we'll get a little deeper into the subject. But thank you very much for your contribution.
Thank you for inviting me.
All right. Now, please stay with us, because after the break, we now focus on girls and women, and we try and understand why they're vulnerable. Don't go anywhere.
Food Food for thought, in the words of Ray Davis. Remember, a challenge only becomes an obstacle when you bow to it.
Of dedication and perseverance, Abayani Maitakore made history as one of South Africa's best performing matriculants of 2014, attaining 7 distinctions.
I believe that nothing should stand in your way if you see yourself in the future doing something great. So I just carried on and I never gave up. Though the circumstances I faced were challenging, I love challenges, so I was like, yeah man, bring it on, I can do it.
Join me, Refiwe Muiba, on Bophelong, your show about those who take on and conquer life's challenges, every Saturday at 17:30.
Welcome to Network, a technology news program that also discusses what's trending in social media in and around Africa. MTN has launched its new movie and television streaming service, Front Row. If it's trending, we will find it. That's Network with me, Spumelele Zondi, every Sunday at 7:30 p.m. only on the SABC News Channel.
Welcome back once again. Now, many children in Africa still face injustice and rights abuses in a number of ways. Of these, inability to access the right to health remains a huge challenge. Now, AMREF has called on society to protect children from the injustice of poor health. AMREF Health Africa believes that socio-economic advancement will only be achieved if women and children are at the center of development. Now, key to this is to ensure that the continental framework for human rights as it applies to women and children is upheld by governments, communities, and individuals. Now, let our guest enlighten us a little more on this. Now, we still have Dr. Flavia Senkobuge, public health specialist at the University of Pretoria, and we're honored to be joined by Dr. Connie Osborne, who's the regional director for AMREF Health Africa in Southern Africa.
Good morning.
And welcome.
And happy World Population Day.
Right. Welcome to Health Talk. Thank you very much. Now, maybe let's just take on that. I mean, we've had fascinating discussions on children and stunting and so on. And we know that, in fact, if you look at the theme for World Population Day is the vulnerable population.
Yes.
Women and children.
Yes.
Firstly, maybe let's ask the question, why should girls and women be vulnerable?
Well, there are many reasons why girls and women in particular are more vulnerable than any other, let's say, gender. There are biological factors, we have social, cultural factors, and economic factors. Let's look at biological. Girls and women, they go through certain phases or cycles in their lives. Every month, when they have their menstrual loss, they're losing blood, which predisposes them to be anemic, and that has other further consequences on their health. And then when they're pregnant, they must feed for 2 people. Delivery, it's not an easy thing. So all these things, biological factors, in fact, breastfeeding. You must breastfeed exclusively for 6 months, and thereafter they must continue to breastfeed up to 2 years.
Right.
And during that time, if they're breastfeeding, they must feed for 2 people. So all these things put women and girls at a higher risk of health issues than men. Then we look at the social-cultural factors where low value is placed on girls and women. In other regions, for instance, if you realize that you're going to have a baby girl, they will literally abort that child because it will not be of value to them. So there is this social-cultural gender inequity, you know, where it's only boys that must go to school and not girls. So there are so many reasons why girls and women are more vulnerable.
AMREF, I mean, is known to have been quite vocal on issues around protecting...
For the past 57 years.
Women and children. But first, tell us about AMREF and AMREF Health Africa.
Now,
what do you guys do?
First of all, some people don't know what AMREF stands for. It stands for African Medical and Research Foundation. We are an international NGO. We focus on health and development. We are Pan-African in the sense that we were born in Africa, we were established in Africa in the late 57, and our headquarters is in Nairobi. More than 90% of our staff are Africans. So we look at Africa's health challenges from an African perspective. This makes us different from the other NGOs. The other thing is our focus is mainly on hard-to-reach, marginalized, poor populations. We believe that to have lasting health change, you must focus, you must place communities at the center of health system strengthening. So our niche is there for community health system strengthening. Our focus is women and children. Men are important as well, and boys. But, you know, whenever there is an emergency or anything, who gets affected first? It's women and children.
Okay. Well, let's talk about that, who gets affected and how. What are these health issues just peculiar to young girls and women, globally and perhaps in Africa?
Broadly speaking, in our first segment, I talked about the fact that, you know, we've got a triple burden of disease, and in some countries, even a quadruple burden of disease. Women are affected by each and every single one of them. I think that's the first thing I want to say. They're affected by communicable diseases, non-communicable diseases, violence and injury, and poverty-related illnesses. But of key is the fact that women are affected disproportionately so, and so they're affected much more. So if you look at violence and injury, there's been many statistics which show that women are disproportionately or affected more than men. And if you look at poverty-related illnesses, as Dr. Osborne has just said, because of the reasons of the fact that women and children are more vulnerable, they are more likely to be poorer in society with less economic viability, and so therefore they will be affected by illnesses, all illnesses of poverty, issues around pregnancy and pregnancy-related illnesses, issues around rape, issues around, you know, everything that maternal and child health, everything, the whole spectrum affected, women are affected, but again, my stress is disproportionately so.
Let's talk about reproductive health insofar as it affects, you know, young women and girls. I mean, there's lots of issues that have been put to the fore. Things like, you know, child marriages and the issue of family planning and so on. And of course, all the related problems around maternity health. Please just take us through what the major problems are around reproductive health.
Yes. Let's talk about child marriages. I think this is one of the big human rights violation. No child should have to be made to lose her childhood and behave like an adult when she shouldn't. So, with AMREF, for instance, we have projects where we're trying to eliminate child marriages in Malawi. We have a project called Unite Against Child Marriages, because when you're a child and you get married, eventually you have to be sexually active, get pregnant. Your body is not ready to hold that pregnancy or even to deliver. In fact, this goes to things like teenage pregnancies. When you have teenage pregnancies or children getting pregnant, you have an increased risk of abortion, miscarriage, stillbirth, prolonged labor, all these things which lead to other health consequences. So sexual and reproductive health and rights are very important, and they are at the center of our work. In South Africa, for instance, in Limpopo, we have a project where we are increasing access to maternal, newborn, child, and adolescent health services. So I think that sexual and reproductive health is very important.
The one thing that I think we need to touch on is that of family planning contraceptives, insofar as it relates to world population, because there's that notion out there that contraception or family planning is geared towards, trying to get the world population numbers down as much as possible. Your view on that?
Well, I think that There's nothing wrong with having, let's say, because people say, you know, you must reduce the numbers of children and so forth. Population is important. In developing countries, more people are being born than, dying. That's why the population growth rate is much higher. Whereas in the industrialized countries, the population growth rates are static. They need people for the workforce. They are looking to developing countries for the people. So population, in terms of family planning, there's nothing wrong with having, let's say, for whatever numbers of children that you want to have, if you can afford them. The important thing is to space them.
Space them. All right. I think let's just hold it there because we need to go for a quick commercial break. And when we come back, we'll try and answer the question, what can be done to protect these vulnerable populations that we've spoken about? Please stay with us.
Welcome to Business Review. What a week it has been. The rand has hit a 6.5-year low against the dollar. It's weakened to 11.88 to the dollar. It was trading above 11.70 in December, but it hasn't been at the levels we're seeing today since October 2008.
How do we ensure that we negotiate good contracts so that, money is not flown out of the country?
If we think the rand is low, the Nigerian currency hit 204 to the dollar today, an all-time low. From July this year, the Zimbabwean dollar will cease to exist.
One of the major serious problems is policy uncertainty in Zimbabwe, and the monetary policy can only be a victim of such an environment.
That's Business News, weekdays at 6 p.m. on SABC News.
Welcome back. Now, so what can be done to ensure that we protect our vulnerable populations? Let's put this question to our guests. Now, we've obviously spoken about all these issues around, vulnerable populations, children, girls, women, and so on. And this is solution time. Just let's try and, even if we can't provide all the solutions, but let's, give it a try. Let's start with you. What should be done? And in fact, maybe we could start off by saying, what is the role of government in all of this?
I think, first of all, Dr. Mdong, is that I have to be bold enough and say that we have to have bold policies and we have to be unapologetic about the fact that vulnerable populations, if we are talking seriously about socioeconomic development, we have to not neglect vulnerable populations. So my sense is that more bold policies, and not just only making those bold policies, but implementing them.
Okay. Dr. Moore, international aid organizations, maybe let's talk about your organization. What do you think you should be doing, or what are you doing to try and, minimize these challenges that we've spoken about?
I think as a development agency within a country, specifically, say, like for South Africa, what we are doing is getting together with other stakeholders and interested parties to work with government, just as Dr. Flavian has said, to review and revise policies where the need arises, and be prepared to help government to make informed decisions of how to implement and come up with strategies that will work in order to respond to the needs of those vulnerable populations at the time they need it, in a timely manner. So it's very, very important to have evidence to guide and influence the policies, and to come up with innovation that can be able to respond to the changing needs within the country, and to share what is going on and look at what works and what doesn't work, and build on, scale up what works, and what doesn't work, let it be a lesson, and we move on and not get held back that we cannot move.
Yeah.
And therefore, ours really is to work with government, with other partners, and form a partnership that will actually help the government move forward to respond to the needs of these populations.
The biggest criticism that has been leveled at governments and international organizations in general is that of saying that we seem to be very good in designing policies and whatever, but when it comes to implementation, we found lacking. Your view on that? How can we monitor these policies to ensure that they're being implemented?
I think one of the key things that should be in place is to have an ultimate goal, to have an end result and focus on the result. But to be able to focus on the result and come up with strategies requires some kind of coordination. Because what happens often, take for example with adolescents and youth, or even women, it's not the role and responsibility of one sector within government. It probably involves more than 2 or 3 sectors. It could be the education, the health sector, the labor sector. They need to come together and look at how can we respond to the needs of these populations.
Okay. Let's just hold it there because we have a caller from Lesotho, Pokwe. Pokwe, good morning and welcome to Health Talk.
Good morning, sir, with your colleagues there. I'm really pleased to look at the TV today while you are speaking about the health and care of the children. We are really concerned. I would like to congratulate you for that effort you've taken with your doctors there of different countries that are just giving us that education. We have seen that most of our women getting pregnant are really not cared as properly as they could give their best to healthy and sounding children. Therefore, we are pleased. We have seen in the country as far as the immigration people are getting into other countries for their safety, most of our women there are really in a difficult problem because they walk long distances while they are pregnant. Most of the children have died through that pregnancy and that problem. That is worrying us as African too, looking such things happening in our country. I am pleased that you are urging all the African leaders with their governments to look into this. How can they prepare a good situation for these women who are pregnant?
Okay.
Because I've noticed that the nutrition for the children is one of the most important things you are talking about.
Yeah.
They don't have those nutrition diets.
Yeah.
I therefore really congratulate you because you are always looking on the TV and these
All right.
International organizations are trying their whole best.
Thank you very much. Thank you very much, Puka, for your valuable contribution. Let's get a comment from AMREF.
Yes, I think that it's very important that government takes the health services to the people.
Right.
Health services should be as close to the people as possible. That's why most governments are embracing primary health care. Here in South Africa, for instance, they have now re-engineered the whole primary health care strategy, where they have established what they call ward-based outreach teams, which are comprised of a professional nurse and community health workers. And they reach out and work in the communities where they live, providing primary health care service like antenatal, family planning, HIV/AIDS services, things like that. So it's very important. I think the caller said pregnant women are having to walk long distances. This should not happen. The services should be as close to the people as possible. That's one of the policies, things that should be in
and
place.
Just to add on is the fact that there's something that is new that is happening. We know that people are going to be moving around in different countries, and so we no longer look at health as just our own countries. We're now having regional conversations. So for instance, if you look at the SADC region, we now are having conversations about how do we have a uniform policy for the SADC region on maternal and child health, because we know, like for instance, the caller, people from Lesotho will come to South Africa and deliver in South Africa. People in South Africa may go to Zambia, may go to Zimbabwe. And so there is a conversation about regional, regional policies for health. But what is key is implementation. And for implementation, you need technocrats who are passionate about what they are doing.
Exactly. Let's come back to you.
I just wanted to follow up on Flavia. Like health issues like tuberculosis, for instance, malaria, cross-border. South Africa is doing very well in terms of malaria control. But as long as malaria is not controlled in Zimbabwe, Mozambique, so you have to have this regional cross-border programs.
Exactly. I mean, a good example is TB.
TB, malaria.
But it also requires political commitment and will.
Yes.
Without political commitment and will, and at the highest level, then it may be an uphill task for the technocrats and the willing people who want to move the agenda forward.
What about funding, though, by the way, for these initiatives?
Well, health is a very expensive commodity. And funding, well, some governments, do well. They have the funding, but sometimes they don't have the capacity to manage that funding. A lot of countries which are maybe doing better than the others, you find that their health indicators are not as well as they should be. And it's because, yes, the money is there, but the capacity to implement the programs may not be there.
Okay, let's move away from government for a while. Society, families, I mean, surely people have a role to play in that regard. Your view?
Absolutely. I think one of the things is the fact that we do have passive communities, and then we need to empower actually communities to be active participants in their own health. No longer are we going to have an autocratic society telling you this is what you need to do. And so one of my key things that I'm passionate about is actually saying that we need to have bolder communities who are willing to move away from what they have been taught in the past in terms of the begging bowl and sitting back and receiving, but they need to be more actively participating in their own health.
Okay. Your last word, 30 seconds each.
Well, you have a strong family, you have a strong nation, you have a strong world.
People are what makes a nation. And it's so important to invest in the people. But to be able to invest in the people, you need to know who are you investing for, where are they, and what are the issues to prioritize in investing for them. And if we do that, I think, as a country, as a continent, we will make headway.
And mine is, if we are serious about socioeconomic development, women and children should be at the center of that.
Yes.
Wow, this has been such a fascinating discussion. I learned so much from this. Ladies, Dr. Flavia Senkobuge, University of Pretoria, Dr. Connie Osborne, AMREF, Dr. Esther Moore, UNFPA, thank you so much for your contribution.
Thank you.
Thank you. Thanks.
Right, so unfortunately that's how we come to the end of our show today. And your views and comments, please, as always, share these with us on our Facebook page by going to SABC Health Talk and like our page, and you can follow us on Twitter, SABC Health Talk, or drop us an email at sabchook@sabc.co.za. Otherwise, join us again next week, same time on SABC News. And remember that you can watch a repeat of this show at 2 p.m. and 10 p.m. again tonight. And if you missed any of our previous shows, catch them on the YouTube channel. Otherwise, from me, Dr. Sello Mutaung, and the rest of the crew here, it's a very warm goodbye. Do take care.